Hello children, welcome to the digital class of 8th standard. We have already discussed about public health and government part A. Today we are going to discuss about public health and government part B. Let us have a quick recapitulation of public health and government part A. In public health and government part A, we have discussed basic amenities, public health services, private health services, the motto of the two different types of the government service centers, the quality of the services provided at both the centers. Now we are going to discuss about health insurance, health and equity, statistics of nutrition in Telangana. Let us move towards the lesson. I would like to ask you a question. Health insurance, health and equity, statistics of nutrition in Telangana. Today we are going to learn about health insurance, health and equity and public basic health facilities. I repeat, basic health facilities. After learning these subtopics in public health and government, children, you will be able to explain about the need and requirement of health insurance, classify about private and public healthcare services, describe about whether equality exists in private and public health services or not. Let me ask you a question. Why do we need a health insurance? Health insurance is required for us to take some kind of health related services from private hospitals. At times, you do not find money when you fall sick with severe illness. At that moment of time, health insurance acts as a support and protection to provide you financial support to treat your illness. I hope you understand the importance of health insurance. Health insurance means medical emergencies come unannounced. You get best medical facilities without financial burden. Unfortunately, only 50% of our Indian population is covered in health insurance. Only 15% of our population is covered under health insurance. It is a bad sign to treat our illness. Unfortunately, you see only 15% of our Indian population is covered under health insurance. If you check the ratio of foreign countries compared to Indian countries, there you will have more people covered under the health insurance. We should cover our life and our health under the insurance because unforeseen activities comes forward if any, then this kind of health insurance acts aptly to provide support for us. So, let us improve our cover, our health under the insurance, right? Many companies like Life Corporation of India, Star Health Insurance, etc. health insurance, not only these companies, many companies are providing health insurance to cover our illnesses, several types of diseases under the health insurance. They act as a financial support for us during the time of health emergencies, right? Healthcare. Let us discuss now about healthcare. Healthcare is divided into two types, that is private healthcare service and public healthcare service. Let us now discuss about what is the situation of public health services in present times. In present times, the situation of public health care services which are provided by our government has changed a lot compared to the previous years. In the previous years, we do not have any kind of emergency services provided for emergency cases, but today the situation is changed. It means government is providing ambulance service like 108. 108 is an emergency service provided by the government to carry emergency patients to the hospital and save the life. One of the biggest initiative that has been taken by the government to save the public from the emergency health situations, right. Not only 108, government has also provided 104 service, 102 services, especially 104 services are provided to provide medicines to the public at the village level and at the mandal level. Especially in the rural areas, you find this kind of 104 services which wander in a vehicle. You will see a doctor, a nurse and a health assistant providing medicines and health checkups, especially in the rural areas. Let us see the statistics of health problems in India. 20% of the population can afford the cost of medicines. 40% of the people admitted in the hospitals are in debts. Medical expenses causes hardship. 20% of the population afford for medical expenses. It means if something happens which is a very emergency, then people cannot afford. As the people are financially not very sound, they couldn't afford for the private hospitals, and 40% of the people admitted in the hospitals are in debts. Unforeseen emergencies, especially health emergencies, makes the people overburdened into the debts, because of which mostly poor people cannot afford for the healthcare services, because of which they are overburdened with debts. And medical expenses causes hardship. If you go to a private hospital, the expenses of medicines, tests, diagnosis cost a lot, and it hits a person a lot, and it makes the person deeply overburdened into the debts, because of which mental, psychological health condition of a healthy person will definitely decreased, and definitely most of the people do not afford to the cost of the medicines, and they do not opt for the private hospitals, because of which they lose their lives in spite of bearing the medical expenses, especially in the private hospitals. This is what is happening in, especially coming to poor people in India. What are the basic reasons for every illness? What are the reasons that makes people ill? Yes, our daily diet habits leads a person to illness. If you are not properly taking our diet on time, definitely it makes us ill. Not only proper diet, lack of safe drinking water also makes people, if we do not take the safe drinking water, definitely people fall sick and it leads to illness. Most of the people living India at the roadsides or who do not have clean living areas, of course the basic things which makes us ill are lack of proper diet. If you are not taking proper diet, definitely we fall sick and it makes us ill. With proper diet, we should take safe and clean drinking water. Lack of clean and safe drinking water also makes us ill and sick. Most of the people living near the roadsides who do not have proper housing facilities, people who are living near the roadsides and people who do not have at least the housing facilities will definitely drink the unsafe and unclean water, which leads them to fall sick. So, children, you should remember, never take contaminated water which leads to illness and fall sick. It leads to suffer from different kinds of diseases like diarrhea, malaria, typhoid, etc. and variety of viral diseases will get to us if we drink contaminated water or unsafe drinking water. Lack of clean surroundings. If we do not have clean surroundings, definitely it also leads us towards illness. If the surroundings are not clean, definitely mosquitoes breed, and due to the bites of mosquitoes, definitely we are going to suffer with malaria, typhoid, diarrhea. Such kind of diseases gets attacked if we do not have clean surroundings. Children, you should keep your surroundings neat and clean, whether it is your house or your school. Do you know India has one of the largest number of cases of diseases such as diarrhea, dysentery and cholera. Over 1600 Indians die every day because of water related diseases. Deaths can be people have to access to safe drinking water. It means India have lot many people who are suffering with different types of diseases because of lack of safe drinking water and clean drinking water, lack of clean surroundings and lack of cleanliness and hygiene conditions around their surroundings. This is what the statistics say. I hope you understand, and you should practice in your places to keep your surroundings clean and to eat the diet proper way, and you should drink clean and safe drinking water. If not available, at least boil the water and drink. This is a small tip for you all, right? What other essential facilities to be provided for a healthy living? To lead a healthy life, we need good food. Good food means not all the junks like chocolates, biscuits, burgers, pizzas, all these things. This does not lead you towards a healthy life. Healthy life, if you need, then you should take good food. Good food means good fat related foods, fruits, leafy vegetables, dal, egg, chicken, etc. All these things will make you healthy and it leads towards a healthy life. I hope you will follow all my advices to lead a healthy life. Will you follow, children? Good. Not only good food, we need good health assistance. For once in a month, definitely we should have a good checkup at our village level hospitals, so that our weight will be checked by them, and we can also know whether we are in a proper weight or underweight. They also check the nutrition levels of the people, and the nutrition levels of the children are also checked, and balanced diet is also very much important to lead a healthy life. To lead a healthy life, we also need a good transport system, good education, electricity, etc. We need transport system to travel from one place to another place. If we go on walking from one place to another place, good transport system is very much required for all of us to move from one place to another place. Moving on from one place to another place by walking, it means our energy levels will get reduced, but in recent times it has been declared that we should walk a lot. We should use the transport system whenever there is an emergency or for the long travels. To buy vegetables or to go to your school which is nearer, to move from one place to another place which is around 1 kilometer, you can go by walk. It is also a healthy for you. healthy thing. Walking makes you healthy and energetic. And one more thing is electricity. Electricity is very much required not only in the public health services, it is required for in agriculture, even for all other services like in education, etc. Right? Shall we have an assignment, children? Write any 5 uses of health insurance. List the diseases caused by contaminated water. I hope you can do it easily. You know well, if you drink contaminated water, what kind of diseases gets attacked, right? List them and show it to your teacher. Do you agree that private companies work on profit motto or not? Yes, of course, private companies works on profit motto only because it does not provide any service on free of cost. For each and everything, we should pay the money. So, with this you can get a conclusion that with this you can get an idea that private services, private sectors, whatever it may be, health or business or whatever, private services will not work on a free of cost. We should pay money. Why private companies are not interested in services like cleaning drainages, medical campaigning? Can you tell me why the private companies are not interested in cleaning drainages and medical campaigning? Of course, we see all the government workers, contract workers go on working to clean the drainages, and in the medical campaigning you mostly see ASHA workers conducting campaigns, doctors also conducting campaigns, especially government doctors conduct the medical campaigns to provide service to the public, but never ever you see private sector in cleaning drainages or providing any kind of medical campaigning. Why? Because they work on profit motto, not on service motto. Only the public based companies go on service motto. Public health services, any public related, it means government related companies, government related services are providing service to the public on a free of cost, but not, yes, private sectors, right? Private companies are interested in establishing schools. This is also for profit, right? Even in the government schools, the same education is provided, and in the private sector also the same education is provided. But a small difference is private sector provides a little bit extra information compared to other services. So, most of the public who are financially sound and fit, most of the people who are financially fit and sound move towards private health services rather than public health services. Private health services also established hospitals to provide health care services. Comparing to the public health services, private services are interested in establishing hospitals because they can get lot many profits by establishing the hospitals and providing the health services to the public by providing lot many cloth centers and business oriented centers. I repeat, private services also include providing sealed drinking water. The cost may be very less, but it provides good quality by providing a seal where only financially fit and marginal people can also afford to buy this kind of sealed water and can also move towards the private services in spite of the public services. The motto is only one, that is profit. You should remember that. What is the role of government in providing public facilities? Why the government must bear this responsibility? The role of the government providing the public facilities is no one should be left behind to get the services, especially health related services and education. If the government provides health, education, sanitation, clean drinking water to its public, definitely in future people will be healthy, they will be well versed in education, they get well versed knowledge so that the country will get developed. This is the motto of the government, to provide services especially related to health, education, transportation, etc. Did you understand, children? Fine. Let me show you the Ministry of Health and Family Welfare providing different kinds of health services at different departments and different levels. Department of Health and Family Welfare, it provides national level programs for disease control hospitals and dispensaries and medical education. Department of Ayush, it looks around the local system of medicine such as Ayurveda, homeopathy. Department of Health Research is associated and concerned with researches in health activities. Government is also providing different departments for AIDS control take-ups, programs for prevention and control of AIDS, that is HIV. Let me show you the status of nutrition in Telangana. Basic amenities for healthy living. People are undernourished, lacking purchasing capacity. Nutrition statistics in Telangana and Andhra Pradesh shows that basic amenities are provided to the public, but most of the public is not able to receive these kind of basic amenities provided by the government. Especially 1 out of 2 people are dying due to several kind of infectious diseases like tuberculosis, HIV, typhoid, malaria, diarrhea, dysentery, etc. And 31% of women are dying due to infectious diseases related to women. 25% of men are dying because of lack of immunity levels. Most of the children below the age of 5 years are dying lack of enough nutrition levels because they are born with undernutrition. It means this is the time to educate yourself and educate the people in your surroundings to take the healthy food, to take the nutritious food and a balanced diet, to improve your weight levels and immunity levels by taking good food and live healthy. I hope you have understood better about public health and government part A and part B. Let us meet in the next session with a new topic. What provides energy to our body? We need adequate fat, proper food and no special medicine. These are the secrets to get energized to our body. Statistics revealed by WHO. WHO means World Health Organization. 53% of people are associated with infectious diseases. 33% of children in Andhra Pradesh and Telangana are characterized as underweight. 31% of women and 25% of men are undernourished. AP Human Development Report 2007 describes that freedom from hunger and malnutrition is a basic human right for human and national development. Better nutrition means strong immunity systems, less illness and better health. Can you suggest some measures to increase the nutrition levels among the people? I hope you can do it easily. To improve your nutrition levels, what the things you have to do at your home? Kindly share with your friends and do the assignment, right? Please visit the official website of SIET and complete the worksheets. I hope you have understood better about public health and government and the subtopics of the lesson. Let us meet in the next session with a new topic. Till then,